Hello students, today we are going to simple method for animal dose calculation in preclinical research. That is one of the experiment in our uh, pharmacology 3 semester 6B pharmacy syllabus. So here we will learn the dose calculation in pharmacological experiments with the help of this paper, which is authored by the Vijaya Pandi. So here he has given the method for the animal dose calculation in preclinical research. So as we can see here, the paper published here, it shows that the preclinical research, the experimental animals are dosed according to their body weight, and the selection of doses is usually decided based on the oral toxicity studies. In most cases, at least 3 doses of test compound will be used to demonstrate the dose dependent effect. If the preclinical research is based on the clinical findings, the human dose is converted into corresponding animal dose using this formula. So here you can see this formula is given. Animal dose in milligram per kg can be calculated as animal dose is equal to human dose into human oblique divided by animal dose. So here you can see the correction factor Km given body weight by body surface area. So Km for human is equal to 60 by 1.6, that is 37. For rat, the 0.15 by 0.025 is equal to 6, and mouse it is up to 3. So by using this, for example, when we are calculating the dose of telmisartan, the human dose is 0.67 milligram per kg. So the rat dose of telmisartan can be calculated as 0.67 into 37 by 6, that is 4.13 milligram per kg. And for mouse, the same procedure we can use 0.67 into 37 by 3, that is 8.26 milligram per kg. So by using this formula we can calculate the dose of the drug, but how much volume there should be injected in the animals. So it is important to determine the volume for injection according to the body weight of animals. According to the volume of injection for each animal is the time consuming, and there is a chance of error. To overcome this issue, the following tips can be useful here. For rats, where we are using the test compound which is sparingly soluble in water, and that is intended to be administered at a dose of 100 mg per kg intraperitoneally, the concentration of drug solution could be used as follows. For example, here when the dose is 100 mg per kg, a stock solution of 100 mg has to be prepared. If the dose 200 mg per kg, prepare a stock solution of 200 mg per ml, so on. By this way we can prepare the stock solution. So the compound, when it is sparingly soluble, we can add the carboxymethyl cellulose, acacia and tragacanol to make it solubilize in the solution. Then the next part is what here we can see. For mice, the procedure is also same. We can use the formula here. If the dose for mice is 100 mg per kg, a stock solution of 1/10 of dose per volume of, that is 10 mg per ml, has to be prepared. If the dose is 200 mg per kg, a stock solution of 20 mg per ml has to be prepared. So here the table is showing here, you can see according to the body weight of the animal, an appropriate volume of drug solution should be administered. So here you can see the different route of administration, that is post-oral, that is per oral route of administration, then subcutaneous, this is intraperitoneal, this is intramuscular, this is intravenous, and slow injection intravenous. So in mouse, ml per kg has been given. The 10 ml per kg as per the OECD guideline, the volume is administered, and maximum 50 ml per kg can be administered. In rat it is about 10 ml per kg and 40 ml maximum can be administered. For subcutaneous route the same is here again. 10 ml is the per kg for mouse, 5 ml per rat as per the OECD guideline. So this table is given as per the OECD guideline to the maximum volume of injection or the volume of solution drug in the rats and mice that we need to follow here. So here we can see, in conclusion, it is suggested to use the simple method for animal dose calculation to avoid dosing errors that leads to erratic results in the preclinical research. So here we can see this is the method by which we can use the dose calculation in the preclinical pharmacological experiment. So as we are calculating this, we can, by using this different guidelines, OECD guidelines and these formulas, we can convert the different doses for the rats, mice, or this by using this formula and this kind of calculations. So hope you have understand the dose calculation which are useful in the pharmacological experiments. So that's it for today's experiment. We will see in the next experiment in the next video.